Are we talking about breasts? I mean, I love going through puberty with more and more people talking about breasts and puberty. Let's go. They're like, wow, I'm going to get breast. A lot of girls have large breasts, and this is where you guys come in, right? I mean, I don't mean to say y'all have large breasts.
Girls. No, we do.
Chest out. Be proud.
Say it with your chest.
You know what I'm saying?
And 60% of kids admitting not learning anything about periods from schools, and about 50% not. Oh, what's a period? She goes, it's when you bleed between the legs. I'm like, where? At the knees? I mean, I was 9. So girls are definitely going through puberty sooner. And what we hear often as parents are like, when do I need to have this conversation about puberty? And I say earlier is better.
A sea cucumber.
Sea cucumber.
Interesting. Yeah.
Is there anything out there that tells us why girls are developing earlier?
Don't judge your development by someone else's. That goes for so many other things in life. To embrace the changes because your body is growing and changing. These days, if you don't like it, you can change. You can for a small fee. That's quite large. Inflation. Yes. To inflate your breasts. Exactly.
8 and 12, but it's very interesting because people of color, 25%.
So,
Wow.
It was buds, period, breast.
And she said it was nail heads, rosebuds, roses, and then hanging baskets.
We're experiencing the bleeding and the budding and the breast tenderness. What are you going through at this point?
Guys just wanted to see the breast and see the nipple, man. There was somebody you want to see all that.
They were probably all wrong.
Yeah.
For all those kids out here that don't know what they're doing, it's okay.
Let's talk about breasts.
Let's talk about you and me.
Let's talk about all the good things
and all the bad things. Welcome back to BoobTube. This is episode 52. I'm your best friend, Jaleesa. And I'm Chantel. Last episode, we talked about breasties. And this week, we're going to get into something that kind of goes along with that. It's back to school. You do have your breasties at school. But we're going to dive a little bit deeper into that conversation, especially as it is that time of the year again. But before we do that and get into our special guest today, we have to get to BoobTube on the Move. What lesson about breasts would you have liked your younger self to know?
That they gonna hurt sometimes, and it's normal.
Okay. What lessons about breasts would you have liked your younger self to know?
Probably, I don't know. I don't know. Skip that one.
What is something you heard during puberty about breasts that you later found out to be a lie?
That would be, I used to hear conversations that you didn't want big boobs, but as an adult, it's a delicacy to have them.
What is something you heard during puberty about breasts that you later found out to be a lie? Y'all can't think that far back?
Well, we can think. I'm just saying, I heard about breast. All I know is shit, it wasn't about hearing nothing about breast. Like, when you put your mouth on that thing, boy, a girl gonna be up there doing all this stuff, how she was gonna work. That was all false statement, shit. It really go down.
They always got milk. It's up, yeah.
Huh?
You heard that during puberty?
Yeah. Oh. Yeah, maybe not.
Okay.
Not doing puberty.
Maybe high school. Junior high.
Okay.
I just know that about when they was going through that stage, you know what I'm saying? Guys just wanted to see the breast and see the nipple, man. There was something about it, you wanted to see all of that.
You okay over there?
Yeah. Just wanted to see them.
You know, you young guys. Well, if I heard artists talking about going through those stages or whatever, okay.
So there's a clear difference between what men and women have
Always.
to say. One, I don't know, she just couldn't think of anything. The other, that is true that the breasts are going to hurt sometimes, and it is very normal.
Yeah.
Absolutely. The men. I hate their disappointment,
I mean, that could be a lie.
showing up and wasn't representing well.
That was funny. That they weren't. I thought they meant like they sagged or something, but he's like the padding.
Yeah. What
So.
one friend did say, did it? They fail, but no, that wasn't it. There was nothing to fall apparently.
No beat drop. Was that one? Yeah, that was an interesting perspective. I wasn't really expecting that.
Yeah.
But it makes sense coming from men because
Yeah.
we know how they do.
I mean, yeah, were there anything that you thought of that, any myths or anything going through puberty that ring a bell?
Not that I could think of. I don't think of any myths that I know of. I just know my cousin had told me like, oh, to wear your bra to help to keep them like shaped and stuff.
Yeah.
That's it.
I think over time things change. Like they tell you to wear a bra, they tell you not to wear a bra. So who knows what young girls these days are hearing.
We have different ways that you can treasure your chest that we can share with some of our guests. And we hope that you're sharing this with your teens, preteens, whoever, so that they are informed.
Yes, it's important to be informed correctly because there's a lot of myths out there. There's a lot of stuff out there floating around, but it is the most important thing is that you feel comfortable in your chest no matter what size you are.
That is true.
So let's get into it.
These days, if you don't like it, you can change it.
You can.
For a small fee that's quite large.
Inflation.
Yes.
To inflate your breasts.
Exactly.
All right. Well, it's important to remember that everyone develops at their own time. Don't judge your development by someone else's. That goes for so many other things in life too, but particularly with your breasts. If your breasts are developing early, just know that you're just an early bloomer. If they develop late, just know that you're a late bloomer. But puberty is unique to each person. So just be mindful of that. And honestly, there is nothing you can or should do to try to rush that.
It'll come when it's time.
Yep.
On its own time. Let your body work. Another thing you need to do is to embrace the changes because your body is growing and changing. And it is a natural part of becoming an adult. It's something that we're all going to experience on our own timelines and in our own ways. So as those changes come, just know that they are coming and just embrace them because it's inevitable. There's no way to stop it. So just embrace it as you become an adult and reaching that next stage of life and try to find the positives and not dwell on any negatives, even if you feel some pains or you feel like people might look at you or something like that. Just try not to dwell on the negatives and focus on the positives.
Absolutely. And know that people are going to look. We all have eyes. So it's just how you react to that. And don't let it become a big deal just because everybody's observing other people. That's who we are as people. So keep that in mind. Find the right bra. Get educated on what a proper bra feels like for your body. We have a bra fitter here. You can go find a bra fitter. But the important thing is to make sure that you feel comfortable in your bra and to make sure that it's a fit. And know that as your body changes, you have to get fitted. I'm doing pop-up fittings now, and even mostly with a lot of older women, like still reminding women, as your body changes, you're losing weight, things change. But so many women stick for years in the same bra, even as their body is changing. So particularly during puberty, you're still growing. So just be mindful that you are not going to be the same band or cup size probably throughout your school days and even afterwards. So continue to get fitted for a proper bra.
Yeah, especially during those years. I remember like each back to school year, back to school season, I was like getting a new bra size. They were probably all wrong.
Yeah.
Because I was wearing like 36Ds and stuff, and to this day I still don't even wear 36s. So
yeah, I think we just go in like, oh, try this on, and we think it worked.
Yeah.
Like I didn't get properly fitted until I was an adult, but it's like, okay, I think this is what it works, and you continue to do that. You find that one, bra size, and you can go from there. Because I'm pretty sure, like a 36.
I was just,
and I think we do it going from what's comfortable.
Or just what we know.
Yeah.
Because like 30, I feel like 36 was just such a baseline size for everyone. I don't know. Everybody's
And
wearing
when
like
you
a
was
36.
younger,
It wasn't their real size. I just feel like it was a popular
because that
size.
seems like a big band size for young girls.
I mean, even the song Brick House, they say 36. I just feel like,
Oh, maybe that's what's in
yeah, not the real baseline, just what people would go to.
too. Yeah, I mean,
Like,
people could fit a 36 and fill it out.
Yeah.
Just not, that band might be interesting.
Yeah. So I like each year, I was probably just like going up. I probably went from like a 36C, and then it was like, okay, 36D or something. And I don't know. I just kept trying to feel it, bro. I could feel it.
I think I was a C for the longest. In reality, I probably was not a C in high school.
Yeah, I know. Exactly. That's what when I got my first fitting in high school, maybe my junior or senior year, and that was at a 32F. So
Wow.
I was every year before that, I was, I'm sure, in the wrong size.
And I'm thinking C, you talk about like things maybe have been implanted in us. C, at least in grade school, is average. So maybe we just stopped at C because that's what we were used to when it came to academics or something. I don't know, but D was failing in that.
It just wasn't it.
No.
It just wasn't it. But we made it work back then, and we're trying to make the change now so that young girls don't have to go through what we went through. And that actually takes me to the next point, which is maintaining good posture, which I feel like I didn't have that growing up, because I remember I still kind of sit like I like sitting with stuff in front of me. Like usually if I'm on a couch or something, I'll put a pillow like right here.
Mhm.
But I remember like back then, we didn't have everything so electronic. So my binders and folders.
What is a binder?
Yeah, I know. A trapper keeper. I would like just sit like this, just naturally. And but I kind of like go like this sometimes or something. And I do feel like because I didn't have the proper support, that I would tend to kind of hunch over, and that was something I had to work on later on in life. And I wish that I did have the proper support to help me have a better posture when I was younger. It's not horrible, but I just feel like that's something I wish I would have had.
I think everybody's posture can be improved.
Well, yeah, especially since we are now a lot on computers more than ever. But
even in school.
Yeah. So keep your shoulders back, chest out, be proud.
Say it with your chest.
You know what I'm saying?
Which brings us into practicing self-care as well. Maintaining that posture when being mindful of that is going to help you practice that self-care. It's one form of that. But also taking care of your skin. And yes, our breasts have skin, so take care of your breasts as well too. That can include, using gentle cleansers. When you do purchase bras, be mindful. Wash them gently, and then let them air dry. Don't put them in the don't put them in the dryer. But that helps to maintain the longevity of your bras, but also it makes you feel good too when you have lasting bras that look good, because you don't want the seams and the wires, if you wear wires, poking out, because that won't set you up for a good day.
So also try to stay active, just because that just helps with your overall health. And make sure that if you are doing that, to use sports bras. Those are always good. And it's very common, of course, like the pullover sports bras. Those are very popular, but do know that they do have sports bras that come in cup sizes. So if you need to, you can have that extra support, because all breasts aren't made equal, and some of us may need a little more support than others, or want a different type of support. So yeah, make sure you're doing that.
Yep. And even your own breasts are not made equal. So be mindful of those changes too, because yes, your two breasts who may not be equal are going to be tender at some point too. And it's okay. Just know, be aware, self-aware of your body, so that be in tune to your menstruation cycle, just because that plays a part in tenderness as well. But knowing your body can help you manage when those changes do come, particularly as a young woman. And then there are going to be some changes when you get older too, but making sure that you're in tune with that, because that can help you uh, find the right support you need or right treatments or whatever it is to help you feel a little less tender.
Mm-hmm. And make sure that you are respecting your privacy and maintaining boundaries. That's a common time where, you might have, especially if you have like around the household, you might have been used to not having to worry about breast or think about breast. And now you're starting to grow breasts and you're like, So now you might feel more compelled to close the door behind you when you change or something, or you don't want people in the room with you when you change, or you don't want them to see you. Or if you go shopping at the store, your mom might be like, let me see how it fits. But you don't want to come out, or you don't want her to see you till your clothes are on or something like that. Even though, of course, your mom has breasts too. It's very normal for developing young girls to feel kind of a little shy at first once they are developing. And that's okay because, not everyone's supposed to be seeing your body parts like that anyway. So always make sure that you are maintaining the boundaries that make you feel safe and comfortable.
Absolutely. And seek reliable information. Again, there's a lot of information out there when it comes to breast and breast health. Talk to a healthcare provider or a trusted adult that knows about these things so that you can make the right informed decisions when it comes to taking care of your breast.
Right. And also make sure that you're celebrating your uniqueness. Like, we are all made to be unique. The world would be so boring if we were all the same. We have similarities, but we're not all the same. So make sure that you're celebrating your uniqueness. Your body is going to be different from your friends, your cousins, your whoever. So that's okay. Make sure that you are comfortable with yourself, and remember that your individuality is what makes you you, and remember that no one else can be you. So take pride in who you are and just celebrate that unapologetically.
Absolutely. So we've talked about some ways to treasure your chest, as you should. And now we're going to bring in our guest speaker, Dr. Trish Hutchison, who will provide us with some more information on how we can continue to treasure our chest.
All right, and continuing the conversation with our Back to School series, we have Dr. Trish Hutchison here to help us become more experts on our bodies, particularly when it comes to breast and puberty. So welcome, Dr. Trish.
Thank you for having me. I love going through puberty with more and more people talking about breast and puberty. Let's go.
This is the most excited I've been to talk about puberty.
Yes.
And with your experience as you are the executive director of Period Education Project, that's really, really cool. Like, that should be, everybody in their city should have these. We'll talk more about that too. Co-founder of Girlology, and you have authored a book, Youology. So you have a wealth of knowledge that we are eager to get into. So, but first, what led you to becoming a doctor, a pediatrician as your actual practice?
Well, that's a long story, but I'll make it really short. Nobody in my family was in medicine, so I didn't know much about medicine. And I actually went to college to become a marine biologist, but a sea cucumber threw up on me and it freaked me out.
A sea cucumber.
Sea cucumber, inverted. And then I'm like, oh, I can't handle this. So I just continued on my way for biology, but I had a great advisor that kept asking me about going into medicine. And I was so resistant until my senior year in college. So for all those kids out here that don't know what they're doing, it's okay. I didn't know till I was a senior in college. But I knew I loved working with kids. I knew I wanted to work with kids. And so, yeah, it was an interesting journey of becoming a pediatrician. Now I have kids throw up on me all the time. But sea cucumbers gross me out, but kids gross me out too, but that's okay. Only when they throw up.
You're in it now.
Yeah, that's just a little different. Okay, so like I said, we're focusing on puberty. What are things that can be expected prior to and during puberty when it comes to the breast?
Well, 85% of girls start puberty with breast buds, and that can be anywhere between the ages of, we usually say 8 and 12, but it's very interesting because people of color, 25% by the age of 7 can have a breast bud. So definitely, if you have questions or if you notice any sort of breast development in your kids, and you're younger than 7 or even 8, please check in with your healthcare provider. But, you know, in the 1970s, average breast bud was around 11, and now averages around 9. So girls are definitely going through puberty sooner. And what we hear often is parents are like, when do I need to have this conversation about puberty? And I say, earlier is better. You know, start talking when they're 4 or 5, tell them the proper names for their body parts. You know, we just need to let them know that these things are normal. And if kids understand the changes before they happen, they face it with so much more confidence and less anxiety. And that's what we want for all our kids, right? We just want to make sure that they can face these changes.
Is there anything out there that tells us why girls are developing early, or even why women of color are developing early?
I wish we knew. That is a great question, but there's a lot of factors that play into it. And a lot of them, they think about nutrition, like poor nutrition, obesity, processed foods, things like that are just messing up, because a lot of the fat in our body actually convert the fat to estrogen. So you have more estrogen circulating in your body, which estrogen is what starts puberty. The other is there are a lot of toxins in the environment that sometimes we don't have any choice. It's in the air, it's in the foods we eat, it's in fast food containers, things like that. So these actually just disrupt the way our systems work. So a lot of times we'll be starting puberty a little bit earlier because of that. And then there's not new research. There's a lot of research on just psychosocial stressors. So kids that are born early, low birth weight, if kids that have poor emotional attachments, any sort of childhood trauma, and actually even not having a biological father around. These are some reasons that puberty is happening sooner, but it's multifactorial. Nobody can point to one thing right now. But there's a lot of research that needs to be done in this for sure.
And you've confirmed some of my theories.
See?
I feel like it was a lot of food stuff too.
Yeah.
Yeah, definitely. What are some common things that you hear from patients or clients in your line of work in regards to puberty?
And I think I mentioned that is just, when should I have that conversation? And I don't feel comfortable having the conversation, because when I grew up, you know, it wasn't talked about that much. So a lot of parents today don't have the tools or the comfort to have the conversation. And some parents really had a terrible conversation. It was the gym teacher in 6th grade, male, that started talking about puberty with them. And so their experience was horrible. But what we have to realize is that we want to create a better future for our kids. So we have to unpack our own baggage around this conversation and really do our best to create something better for our own kids.
So mostly you're hearing from the parents as ways to get into it, but not so much from the kids themselves going through puberty.
The kids, if you bring it up before changes happen, they're actually really excited about it. You know, we talk about breast buds with kids before they happen. They're looking down their shirt and they're like, wow, I'm going to get breast. But if they're in the throes of it, they're at like, oh, I already know it all. So they don't really want to talk about it. And so that's another really good reason to start sooner than later. And you know, one thing that I see in my office often is, when you develop breast buds, and we can talk about how that happens in a minute, some kids will develop one side and not the other. And there's so much conversation out there about breast cancer. And so I was examining a child, and I said, look, you have a breast bud. You've actually started puberty. And she started crying because she thought she had breast cancer, because her aunt was just diagnosed with breast cancer. And she couldn't understand why one side had a breast bud and not the other. And so again, this is just those conversations that we need to have early, because there is this big concern about breast cancer in some of our little kids.
It reminds me of a episode we had called Everything Ain't Cancer, because that's like everyone's go-to when it comes to breast. Like anything you think about breast, like, oh, breast cancer, breast cancer. So that makes sense. It's unfortunate because they're so young, and I mean, not that
They're
they
scared.
can't.
Yeah.
Yeah, not that they aren't to think like, oh, breast cancer is nothing, but it's unfortunate that that's like their first thought. But I also just had a friend's daughter that is starting to bud, but she was telling me how, like, one day after the shower or something, she was saying how she felt something, and she was telling her like, oh, you're probably budding and stuff, but didn't feel it in the other one just yet. And then later on, like, was telling her, don't worry, it's probably just that, but if it's anything else, like, we can go to the doctor. And then shortly after, maybe some weeks or something, she was like, oh, I feel it in the other one now too.
It can take up
So,
6 months for one to the other. So it can actually be quite a long time.
is the one that starts first, is that the one that tends to be the bigger one?
That's an interesting question, because some people even believe that if you start sooner, you're gonna have bigger breasts, but that's a big myth too. But all women, not all, but majority of women have some sort of asymmetry
Right.
in their breast.
Yeah. A lot of women, they'll be like, "Oh, well, I breastfed and this the one they sucked on the most." Like, okay.
So those breast conversations continue even before after puberty. Like,
Absolutely.
Yeah. I've heard that so much. Okay, so are there some uncommon things that you hear from patients or the parents?
So uncommon things, are we talking about breast? We'll go stick with
Yeah, when
breast.
it comes
Okay.
to the breast
So
becoming.
asymmetry is a big deal. We just touched on it, right? We talked about how one breast bud can develop before the other, but a lot of kids will continue to have asymmetry, and some are really significant with a cup size or more, and they want it fixed, but nobody's really going to touch those breasts until they're completely grown. And so if you have a lot of asymmetry between your breasts that requires surgical intervention, they're not going to do anything till they're 18. And that's really bothersome for some kids that have that asymmetry, because they need to figure out how to put something in their bathing suit or their shirt or something that makes them look like they're both the same size. But asymmetry is a big thing. The other is, and I haven't seen this very often in my years, but it's called tuberous breast, where when their baby's, even before it's born, things are just messed up and the breast just kind of hangs down. You will definitely know if you see a tuberous breast. But again, that's very, very odd, but it's something that would need surgery. And again, nobody's going to really touch them until they're around 18 years of age. And then a lot of girls have large breasts, and this is where you guys come in, right? I mean, I don't mean to say y'all have large breasts.
no, we do.
But some kids or teenagers or tweens, they have these large breasts and they're not supported appropriately, and they're uncomfortable, and they stop sports, and they hurt, and they get teased. And this is a big issue, and this is why I so appreciate the work that you're doing, is because it's really important to help girls feel confident and comfortable with the breasts they have.
Absolutely. And you mentioned the asymmetry. We had two previous guests in the bra making world, the bra company, and oh my goodness, why did it just leave me? What's the other company? Evenly.
Balance
No,
bra.
the Balance Bra Company. We are Evenly.
Yeah, evenly.
Yeah, they make bras for women who have variances in their cups, and so that's an opportunity out there for some women.
When you said why did they leave me, I thought your Zoom cut off. So I was like, oh, she can't see us.
Oh no, my thoughts.
It took me a while to realize you wanted me to think of the company name. I was like,
no worries. And then Dr.
okay,
Trish, you're
got
talking
it.
about girls who develop early or have large breasts. We were just at a water park last week, and I remember I see this girl walking around. She has her t-shirt on, but I was that girl, felt uncomfortable because you didn't want to show your body, your breast that you were developed, but you at a water park, like you in a t-shirt, but you go to the pool and you keep on your t-shirt. You're not getting that full experience of being like the other people just because you don't feel comfortable in your own body.
Absolutely.
And what sucks the most is like a lot of teens or preteens that I see that cover up like that. It's like you're really not covering anything. Like we can still see. So I'm sure you can still see everything through that
Yeah, it was a white
heavy
t-shirt.
t-shirt. And when they put on the hoodies, it's like I can still see through that hoodie. But I understand, but I just want to tackle that for sure.
Yeah, it's where conversations, talking more about these things come into play, showing up as beautiful. I would love to hear more about uology. Like, what made you decide to write that book?
So uology is a combination. We had girlology book and guyology book. And so we actually put them together. So it's a gender diverse, it's a book for all kids going through puberty, because we do think it's important for guys to learn about girls, girls to learn about guys, and intergender diverse, just so everybody understands what everybody's going through. You be you, let me be me, that kind of thing. But guys need to understand why we have breasts. They're not a source of entertainment. There's a reason that we have breasts. And I think it's important for guys to understand that as well. So the teasing stops. That's a big thing with uologies. We just need to stop the teasing through puberty.
Love that.
Because they wouldn't like it if they were teased.
Oh, we can't tease about their ball size because you can't see it, right?
Exactly.
Right.
It's not
So like
fair.
all your stuff, It's hidden.
I
You don't
know.
expose, you want to
Always.
cry.
It is not fair.
I know. But here we are.
Yeah. What changes did you notice with your breasts during puberty?
Okay, so that was a long time ago. I'm not gonna tell you how old I am. But I will say when I went through puberty, I did start early. And I remember sitting in that conversation with the small gym teacher talking about puberty way after I'd already budded and had my symptoms. But I just remember pulling on my shirt to make my breasts less noticeable, to flatten them, because my mom didn't give me a bra. So I would just hold my shirt down all the time thinking that was going to decrease the size of my breast. But yeah, it was an embarrassing thing for me because I was young and nobody had told me about it. I was the third child. I guess I just got forgotten. I don't know. Sorry, mom. But it wasn't scarring, but I do remember just getting teased for my breast buds.
Yeah. I was a third child as well, and the other two were boys. So
Ooh, that's all
they
you got to
started
say.
making fun of me running up and down the stairs. Like, right. Well, here we are.
I know.
Yeah.
Um, I was gonna say, did anyone talk to you about these changes? So, did that not trickle down to child number 3? Did you get any sort of conversation?
I eventually got the conversation and got to go bra shopping, but I remember about the whole period thing. I was at home with my dad when I started my period and my brother. And I knew about periods because my sister had blood on her sheets, and my mom was like, yeah, she had her period last night. And I said, Mom, what's a period? She goes, it's when you bleed between the legs. I'm like, where, at the knees? I mean, I was like, what are you talking about, Mom? And so finally she sat down and told me. So I knew what it was, but when I was at home with my dad, it was quite interesting. And I'll tell this story real quick, but there was no products in the house. My mom was actually in the hospital getting a hysterectomy of all things. And my
Wow.
sister was at band camp and took all her pads with her. So I'm at home. So I put toilet paper in thinking that was going to work. And, we had those wide legged pants when I was growing up. Nothing kept anything secure. So the toilet paper fell through. So I finally got up this courage to tell my dad that I'd started my period. And I'm like, I got my period. I was like, got my period. Got my period. And he's like, what are you saying? So I finally, I got my period. And so he started stuttering, didn't know what to do, just was like, oh my God. And he ended up taking me to the handy pantry down the street. I still see it when I go home. And there's like, a few little sections of pads and tampons sitting there. And I'm thinking he's going to grab one. He's thinking I'm going to grab one. And we're sitting there like bobbleheads like this. So finally, he grabs a box and he's just looking at it, turning around. And I'm like, come on, let's go. Let's go. Because I'm hearing my neighborhood friends come in the door with a little bell, ding, ding. I'm like, let's go, Dad. So he finally turns it and he's got, these are really expensive. And I'm sitting there going, what are you doing to me? And he goes, okay, I'll buy these for you if you promise to wash them out and hang them up in the backyard and reuse them. And I went, and then he goes, I'm just kidding. Come on, let's go.
Oh my goodness.
So I think that's why I do what I do now with the Period Education Project, because I don't want anybody to be scarred like I was scarred for a millisecond from my dad.
Oh my goodness. At least he had a sense of humor about it.
At least but I didn't know he had a sense of humor until he said that. I was like, whoa. I just imagine in that millisecond of having my big old, the pads were huge back then, big old pads dripping in the backyard, drying on the clothesline.
And my question was going to be, did he not understand?
Yeah. I was like, oh my gosh, she thought that's how it works. That's hilarious. That's by far the best period story I've heard ever.
I think I was scarred. That's why I do what I do now. But anyway.
You do it with enthusiasm.
Yes. And humor. Humor helps.
It has to. Like I've had period stories. I just got to be humorous about it too. It's like it is what it is. All right. Do you notice any changes in your breasts before, during, and after your menstruation?
Okay, I won't tell you, but I haven't had a period in years.
Okay.
Menopausal.
That's something else we don't talk about. I need to know this stuff before it happens too.
Yeah, you need to have, yes, you got to talk about menopause because it is a mystery and it's scary when it happens. But we do know that while you're menstruating, your breasts do go through changes. Just like your uterus is getting ready and builds up the little lining in case a baby happens, your breast actually, those milk duds, did you hear me say that?
I did.
That's candy, right?
I know, right? That's why maybe I had my head somewhere over there. But those milk glands actually grow because if a pregnancy happens, your breast wants to be ready to produce breast milk. So around your period, right before and soon after you start your bleed, you're going to be really tender and uncomfortable because those milk glands are really growing to produce that milk. And then once your period starts, it goes back to itself. So there are cyclical things that happen with your breast, just like through your system with your menstrual cycle, just to prepare for you to have that baby to be able to breastfeed.
It's interesting. I think that clarifies something I have. I'm like, why do I feel like I'm about to why am I losing my words, first of all? But when I nurse, like the milk is coming, it felt like that, but I was done having kids. I'm like, why does it feel that way? But I only felt that sensation after my third child. And so it's interesting how the body continues to change. And you're still learning things about your body.
Yes. Yes.
Very interesting. I didn't know that. So which typically comes first, breast or the period?
That's a great question. The very first sign of puberty for, as I said, 85% of kids is breast buds. The other 15% of kids will actually get pubic hair first. But breast buds definitely come first. And, I wish we could predict periods and have that magic 8-ball or get a text message that says you're going to start your period and so and so. We don't. It's just not fair. But there are a couple of ways that you can kind of find a window, and it's a large window, but normally girls will start their period 1.5 to 3 years after their breast buds. So that's why I think it's so important that if kids can tell their parents when they got the breast bud, they can put on their calendar 1.5 to 3 years. Other things is they're going to have a lot of pubic hair grown in, and a lot of kids the majority of girls do most of their growth from breast bud until 6 months before they start their period. So if you notice that the height is slowing down in the growth, then be ready for that period within the next 4 to 6 months as well.
Interesting.
Yeah,
I'm thinking back to high school. I remember having a conversation with all girls on the team, but I think she might have been a freshman or a sophomore when she first got her period. But she didn't have much breast either. But so now in my head, I'm seeing that connection between the period, the breast, and probably even the height at this point. But that's just interesting to see that 2020 vision.
For me, it was
Hindsight,
definitely
not 2020 vision.
2020 vision. We follow.
Okay.
It's just I think for me it was buds, period, breast. Like my period started in January, and then by that summer I was just really starting to poke out there a lot.
That's great. You remember the month.
I know. I was like, wow.
I remember the date too.
I'm reading this book about the woman who can't forget. Like she has a great memory. That might be you too. But yeah, mine was
way.
mine was period. No. Yeah, mine was, I don't even remember the bud phase, but breast and then period. Very
And it takes about 3 to 5 years for your breast to finish growing. So from bud on, I mean, there's stages that you go through. You get that little breast bud, which is really tender, one side more than the other. You can get the little puffy nipples that people are so embarrassed about. And then your mound gets a little bit bigger. And then stage 4 of Tanner staging, it looks like a party hat because your nipple or areola makes a separate little section than your breast. And finally you have stage 5, which is your adult breast. But my grandmother was so awesome. She decided to teach me about breast budding. And she said it was nail heads, rosebuds, roses, and then hanging baskets.
Okay.
Just think about it. Little nail head is the bud.
Yeah.
Rosebud is a little bit bigger, roses, and then the hanging baskets. So
go grandma.
I know.
You're really destined to be on this path with your family history.
I know.
It led you here. Like you were definitely born into the right family for this. And then the thing you're just talking about, the pubic hair, that's like a whole nother thing. And yeah, because I didn't think about that before, which obviously is a part of it. Maybe it's just because we're focused on breast, but it's definitely a thing. And then well, for me, it was budding, pubic hair, period, breast.
Yeah, that's right.
But it's then that made me think about when we talk about hair on breast, because I feel like you start to see it when you grow up. You're like, wait, there's like a little hair
Nobody
there.
talks about hair on their nipples.
Yeah.
We
No.
do. We did.
Yeah, we did.
That's
Because
part
that
of
was
it.
I remember a clip with a guy from a podcast where he said that was the first time that he felt like he was grown or with a woman. I think he said like when he felt grown, it was the first time he saw hair on a woman's nipples. Like that was a turning point in his life.
Was he shocked? Like, oh no, there's
I don't know. But for him, that was the moment for him. Like, oh, okay, I've reached another pinnacle. But he
we got to
didn't.
normalize it. They all have hair.
Yeah, I mean, we have hairs all over our
We
bodies.
do.
All
Yes.
natural, just like little spiders and stuff. That's how we feel.
I
That's
think
how
you
we.
mentioned that in the episode too about some spiders.
I did. My brain is pretty consistent with where it goes, but it's true. Okay, let's get back to some questions.
Yeah. What would you tell your younger self?
Oh, there's so much I would tell my younger self. Do y'all ever think about like one thing that's hard? I think the one thing that I think about a lot is just you be you, right? Just don't worry about others. Enjoy who you are. There's only one of you on this earth. I mean, I can get cheesy and go through all that, but I think it's really important for us to realize that because life is short. And if we're sitting there worried about how we look instead of what our body can do, that's really sad.
Oh,
So
I love that.
I
What-
wish I had listened to just dance like nobody's looking and enjoy and do things without my big breast flopping.
Let them flop.
Yeah,
Let
they're
'em
gonna do what
flop.
they're gonna do.
I know, exactly.
That's
So yeah, I think that's a big one. And I just wish that more girls and women felt comfortable to talk about hair on their nipples, periods, I mean, all these things. We just need to normalize it with each other and just have more just really good conversations around this. I feel like so many women just barely touch on things and they're not vulnerable. If we could just be a little more vulnerable for each other, we could definitely help normalize some of these situations.
With that being said, like, how do you? So with girlology, I think I said that a little
You
weird.
did good, girl.
Girlology.
There you go.
Yeah, I know. I was like, I think I added something
You
there.
got it.
And the period education project. So you're able to work directly with young girls?
Yeah, so we work with young girls and we also work with parents because you can tell the girls things, but if they don't have the support of the village at home, it's really uncomfortable. So it needs to be a conversation. But we also realize there's some girls that don't have parents that have other support systems, guardians, but we like for adults that are in their lives to be involved with these conversations. So they do know where they can have a conversation that's safe and trusted.
Do you experience any barriers when it comes to getting basically like that? Well, are you just working with kids like through your practice, or do you go like to schools and or other organizations? And if so, do you experience any barriers trying to get to those?
Okay, I'm in the deep South. And so the deep South
Sorry.
doesn't want anybody to talk to their kids but their parents. And so a really big barrier sometimes is that they don't trust us with the conversation and they only want to have the conversation. And we also provide evidence-based factual information, right? We don't go off anywhere else. But I think it's really hard for parents, again, because the way they grew up, they have this baggage around it and they have these beliefs and blinders that they're the only ones that can talk to their kids. But sometimes kids don't feel comfortable talking to parents, that they do need an outside resource. And sometimes parents get offended, but I always say, find your village, find your village, find another adult, an aunt, grandparent, neighbor, anything that you feel comfortable with them talking to, because it's natural. Kids are trying to gain their independence from their parents, and sometimes they don't want to go to their parents and ask all these questions. So I think it's really important. Don't be offended as a parent if they don't come to you, and find that village where they can reach out if they have questions. And your pediatrician, make sure that they have one-on-one time that they can sit and talk and get their healthcare questions and need answered without mom and dad breathing down their back. We're all on the same team, I promise you.
We are. I guess I was gonna ask, like, is there a way that you get past your barriers or any thing that tends to help with you?
We have to
having
gain
a-
their trust. And that's the big thing, is just to let them know that what we do, that we don't have an agenda. We don't have a political agenda. We're not judgmental about kids. We
Right.
just give medically accurate information, honest confirmation, factual. The other co-founder and myself, we're both physicians. We're both moms. I have 2 kids. She has 3 kids. So that we just have to gain their trust in order for them to understand that we're not out trying to make some sort of statement that's uncomfortable for them.
It's really, we just live in a crazy world, and I think I'm about to confuse a webinar I was on about women's health and how it's how women are underrepresented in research. But then when it comes to the education in and of itself, we don't even want to talk about these things as it pertains to our bodies, and we need to know these things. And I think with that lack of knowledge, we have these continuing issues that permeate our society because people don't want to talk about stuff or include us in stuff. So
Right.
how are you going to make decisions for us without us, one, but then not even from a younger age, tell us about our bodies. It's going to happen. It's a natural process. We should know about these things. The men should know about these things. Like,
Absolutely.
dad should feel comfortable. I remember my stepdad had to go get pads for me one time, but they should feel comfortable going to the store and picking up these items for their daughter, for their wife if they need to. It's just one of those things that really infuriates me at times because we're not the ones at the table all the time, but this is who we are. We're experiencing the bleeding and the budding and the breast tenderness. What are you going through at this point?
Yeah, we have to find our voice. We got to speak up.
Yeah.
We got to put ourselves in those situations where, it wasn't until recently that it was mandated for women and minorities to be in clinical trials. It's just crazy, crazy, crazy. But yeah, we have to speak up, speak up. I can't speak, and find a seat at the table.
Yeah.
For sure. Are there any recommendations that you have when it comes to a girl's first bra?
Bra shopping can be quite interesting because a lot of times girls want a bra, but they don't want to be seen buying the bra, especially in Target or Walmart where they might see some of their friends. And so what we always recommend is Amazon, Walmart, or even the mom go out and buy them. And just kind of in that first bra, it's a lot of times the same t-shirt size they wear, 8, 10, 12, large, extra large. Grab a couple of them, take them home, let her try them on in the privacy of her bedroom, tell her not to take the tags off so you can take the ones that she doesn't like. But a lot of girls' breast buds are tender and sore, so they want to feel supported in a bra, but you also don't want it so tight that it makes them uncomfortable. So make sure that they can take a big deep breath, that they're not pulling at it, that it's too tight. It should be supportive, but not so tight that it's uncomfortable to them. And some girls never want to wear a bra, and I'm like, that's their choice. It's a personal choice. A lot of cultures never wear bras, and that's fine. So I think if parents could just sit back and let kids decide, because they can be uncomfortable.
A question came to mind when you talk about certain cultures don't wear bras or women. Have you noticed anything like with women who wear bras versus not perkiness? Because someone once told me that they stopped wearing bras because one, she didn't want to, but then she said she noticed perkiness coming back. Do you find that to be true?
I love that word, perky. Isn't that great? Perky breast. It's not fair. It's not true. We don't have perky breasts. But anyway, they need to do some research on this, but a lot of people say that if you support your breast through puberty, it will decrease the stretch marks. And it's Cooper's ligaments that attach the breast tissue to your muscle. And if the Cooper ligament is stretched, it can be painful and cause the breast possibly to not look as perky. So I think as long as it's supportive and someone wants to wear a bra, that it might help with those two things.
Okay.
So is it,
go ahead.
I was gonna say, is it a way that the breast can be more perky when they stop wearing bras? Per se, like
You're asking a pediatrician a question about adult perky breasts. What are you doing?
we're just trying to see if it's true, because we're like, that's what they say.
That's what they say.
But
I have
it's
never
true.
seen any research to show that wearing bras makes your breasts more perky. It may make them not as uncomfortable or, yeah. I will look up that and I'll see if I can find something for you.
Okay. I mean, if y'all want to be free, be free. Just say you want to be free.
Yeah. Don't look too hard.
All right, we're coming near the end, and we always like to end on words of positivity. What is your breast advice?
Wow. I just think you need to be comfortable in the skin you're in and the skin you're given. And whatever it takes you to be comfortable is what you need to do, whether it be bras, no bras. I got a breast reduction recently because mine were driving me crazy and back pain, uncomfortable. And so, figure out what works for you. Surgery's not for everybody. Sometimes people don't need it. Some people like larger breasts. We're all judgmental of other women's breasts, and we shouldn't be. We should all just realize that the breast that they have on their chest is probably what they feel comfortable with, whether it's perky, flat, nipple in, nipple out. I mean, there's so many different situations with breast. Hairy nipples, inverted nipples, we all just need to feel comfortable with what we have because they're meant for a job. They're not for decoration. They're there to help feed babies if that's what we choose to do. They're pretty awesome.
They're pretty awesome. For sure. They are. Okay, so where can people find you?
Yeah, so we have for Girlology is a girls wellness app. You can head over to girlology.com for that. In the Period Education Project, what we do there is we train medical students to lead menstrual health educational workshops in community settings to kids of all genders. So you can head over to that website. That's periodeducationproject.org. And you can always email me if you have any questions or concerns or want any information. And that's Trish at periodeducationproject.org. That's a mouthful, I know.
And I love how the acronym is PEP.
Pep
rally.
Yes, that's what we have is pep rallies. That's exactly what we do in community settings. We have pep rallies. So it's a lot of fun. We just had a research, we take a survey, pre and post survey, and 60% of kids admitting not learning anything about periods from schools and about 50% not from family or friends. So you think about half of kids are not learning about periods from family, friends, or schools. So it's kind of scary.
That is, especially in today's time, like we have all the resources, and then we all would think that by now, like our generations moving forward would start having these conversations. So that's really alarming, but there's work for you to do.
Yes, yes.
I think some schools they had where they do the whole like period talk and everything, the sex ed, even if it was just like a 1-day program. I was never at a school that did that, but I think one of the schools I went to, they were like, oh yeah, they did that the previous year. So but I didn't get it. The first time that they talked about it in school for me was my science teacher in 7th grade.
Yeah. And the problem is they try to intermix it with sex education, but menstrual health education needs a spot all its own. Everybody needs to learn about menstrual health because we have to have it. Life wouldn't continue without it. So why we have so much trouble learning about it is crazy, but it does need to be separated from your puberty talk and from your sex ed because it deserves a space of its own.
I think I could imagine if everything was presented at once. That's a lot of information coming at, especially kids. Like you're not going to retain all of that. So if it was broken up into chunks, that would be more digestible.
Yeah, because puberty is 3 to 5 years. You can't tell them all at once because they're not going to remember what's going on. So for parents, it's definitely not a one and done. Check it off your box. It is a continual conversation with your kids. Bless you.
Yeah. So parents, y'all can watch this together. Teens or preteens, ask questions. You have resources. Dr. Trish has put out some great resources. But it's all about asking questions and being comfortable for the parents answering those questions.
Fathers tune in too.
Absolutely.
Yes.
They have a voice.
Like their dad. Don't tell your kids to hang their pads outside. They think that they can reuse them. That was hilarious.
Yeah.
But yeah, I really enjoyed this as if I haven't had a period for many years of my life. But I still really enjoy this.
I'm looking forward to when mine ends.
Yeah.
Don't say that because there's a lot of stuff that happens when your period ends too.
I know, but yeah, we need to have a whole nother section or talk about what's coming next in my life.
Oh yeah, for sure. I don't mind having periods at all. And then I even read a book that was talking about like enjoying that space. How most people see it, it's just like a dreadful thing, but it's like we should honor, what our body's doing and blah blah blah. They said it a lot better than I did, but it makes
That was
sense.
pretty good. That was pretty good.
Because you do feel like blah, blah, blah during that time period. So
Periods aren't all
Yeah.
rainbows and unicorns, but it's a necessary part of life. And, it's funny because there's a lot of research that shows parental or their attitudes about periods goes down on the kids. So we have to be really careful the way we talk about our bodies. We can't call it the curse. We can't talk about our breast in a negative way because it passes down to our kids. But we all know it's not perfect.
yeah, that's good. That's good to keep in mind too, how we're presenting those things to our children. Because
Absolutely.
they're sponges. So well, thank you, Dr. Trish. This has been very informative. Again, Jaleesa and I have been through this, but it's helpful learning the work that's being done out there to help this generations to come learn about their bodies in a positive way. So thank you.
Absolutely. Thank you for having me. This was a fun conversation.
Thanks for joining us for sure. And keep doing what you're doing. I love that.
And y'all too. Appreciate it.
I'll definitely send people your way for sure.
Yep.
Thank you.
So we hope that you enjoyed our guest and got some great information like we did. We definitely enjoyed it. And we hope that you take this information and again share it with some younger girls that may need to see this. Hopefully, maybe even some of our younger viewers were able to see this on their own as well. And hopefully you were able to get some information that is useful for you in your own individual journey. Next week, we're going to carry on with some education about the breast as it is still back to school time. And we want to make sure that our young viewers and our older viewers, of course, are very much informed at this point in time. It's a crucial time for all people with breasts because, a lot of times they get a little neglected sometimes with the back to school. But we want to make sure that we got all things covered with back to school supplies, the clothes, and the undergarments, and the education that you might need. So that's what we're here for. Abu too. So until next time, adios.